Hi, I'm Melissa Maldonado, VP of Client Operations at Progeny, a leading fertility benefits management company. I've experienced helping employers navigate the launch of their fertility benefit, as well as employees navigating their own fertility journey, and I'm also a fertility patient. There are a lot of acronyms to remember when it comes to fertility and fertility treatment. IVF, IUI, ICSI, AMH, FSH, WTF, PGTM, PGTA, to name a few. And today we're going to focus on one of those, and that's PGTA. To make matters more confusing, PGTA has been called a few different things over the years, including PGS and CCS. But for today's purposes, we'll discuss PGTA as it is today, which is genetic testing to count chromosomes. This stuff is a little complicated, but today we have the help of an expert, Dr. Laura Shaheen, a reproductive endocrinologist from Pacific Northwest Fertility. Before we dive in, I just ask that you subscribe and like this video. Doing that helps others to find it. Okay, let's hear from the expert. What is PGTA?
What it is testing embryos for a chromosome balance. Now, there's other types of genetic testing of embryos for very specific genetic diseases like cystic fibrosis or spinal muscular atrophy. But PGTA is really screening each individual embryo to see if they have a chromosome balance. And reasons that people use this is I describe it as an embryo selection tool. So it is a way to select for embryos that are going to have the highest implantation potential and the lowest miscarriage rate. And each patient and their provider should really walk through the testing and really understand exactly what it is. Common reasons that people use it is recurrent miscarriage. So if someone's having miscarriages because they're having pregnancies with aneuploid or chromosomally imbalanced embryos, then they can use IVF, in vitro fertilization, with genetic screening of the embryos to decrease their miscarriage rate. Other women who are at a higher chance of having aneuploid embryos or embryos with a chromosome imbalance are those that are advanced maternal age. And just in the field, we're constantly learning, but right now it seems like the tipping point is age 38. That when women are age 38 or older, the majority of their embryos are going to be chromosomally imbalanced. So you can not only decrease your time to a successful pregnancy, you can make the whole process a little bit more efficient and decrease those failed implantation cycles and the miscarriages, which can really take a long time to recover from, not only physically, but emotionally as well. The process of PGTA does require IVF, so I think it's really important to understand that it does require going through the IVF process with stimulation medications, getting the eggs out of the body, and having the eggs and sperm fertilized in the lab, and watching those embryos grow to a developmental stage where we can then biopsy some of the cells. So usually we biopsy about 5 to 10 cells. It's usually biopsied from a blastocyst. It's about 100 to 120 cells. And it's those cells that get tested, and the rest of the embryo is waiting for when you're ready for transfer.
PGTA is a huge difference maker in modern IVF. The benefits are significant. Anything that can reduce miscarriages, reduce the time to pregnancy, while increasing success rates and removing the incentive to transfer multiple embryos is absolutely worth speaking with your doctor about.
We have learned through doing genetic screening of embryos just how inefficient human reproduction is, and just the fact that most of the embryos that we create are abnormal. And this really can explain why success rates with IVF have gone up. And even more importantly, we've really decreased the risks with multiple gestation. So you can have an even higher chance of success with transferring a single tested or screened embryo than transferring multiple untested embryos, depending on your own situation. And you should really discuss that with your doctor. But that is one of the best advances in IVF, is increasing success rates and decreasing the risk of twins and triplets and more, because we don't have to transfer multiple embryos to maintain a high success rate with this technology.
PGTA is technology that has helped transform the fertility industry, and while it's not to be used in all rounds of IVF, you should feel confident asking your physician about it. And again, it's gone by many names, so maybe jot down PGS and CCS as well. If you want to dive a bit deeper into all things fertility and fertility health, you can find articles and other materials at progyny.com/education. And if you want to hear some stories from others who have been through fertility treatments, you can find those on our podcast, This is Infertility. Thanks for watching, and don't forget to like and subscribe.